Right now, 8:38. It's 54 degrees on the boulevard. And we begin, or we could say continue, our conversations about Mental Health Awareness Month, this time with SpringVale Health Centers, Michele.
Yes, we do. May is Mental Health Awareness Month, and we've got just the man to talk about it. Coming from SpringVale Health Center, we've got JJ Boroski. Good morning, JJ.
Hey, good morning.
How are you today?
Great. How
You're
are you?
wearing green for
Yes.
Mental Health Awareness Month.
That is correct.
And I didn't even plan it. And I walked in, I'm like, we're twinsies. Look at us. He said it was because he's a Celtics fan, but we'll forgive him for that.
That's hard to get over, but we will.
I know, right? So, JJ, over at SpringVale, you guys have so many services available to folks in our area. And I think it is so important to let those who don't really know what you guys offer, and maybe somebody who's struggling is listening and maybe is afraid to get help, kind of tell them how they can get in touch with you guys, what you guys offer, everything great that's going on over there.
Absolutely. Thanks for the question. So we were just talking before the going on air that we were started in 1969 as part of Union Hospital, and then for some reason, don't know the history, but
you weren't around back in 19.
I was not. We broke off, formed our not-for-profit, and our beginnings were in behavioral health, and we did that solely up until 2015. So our services are heavily focused on behavioral health and substance use disorders in our community. We have a full array, comprehensive outpatient package of services, everything from counseling to psychiatry to nursing. We also do substance use services, so we have all the individual, group, family therapy. And then we also have a 24/7 crisis line for anyone that needs it. We have trained individuals available to talk with anyone 24/7. Offer support, offer referrals, connections to services. And then we also have our 5-bed crisis stabilization unit. So for anyone that doesn't know about that, we don't have a local inpatient psychiatric unit for individuals. Those individuals' families needing that service must go out of the area. But we have the 5 beds here in Tuscarawas County, so individuals don't have to leave the county. It is a supervised unit. That's 24/7, anyone needing that extra support. Our providers then work with them to resolve the crisis situation, help them stabilize any symptoms they're experiencing so they can get back into the community, transition home.
If somebody, say, like, because that's such a sensitive situation, whether if you're a family member dealing with somebody else that is going through a crisis and they want to get, that family member help, what's the best way to go about that? Would it just be to call you guys to get direction? How would you recommend someone going about getting them help?
Yeah, so there's a number of different doors that people can walk through. Obviously, anyone can come into any of our offices at any time and request services. One of the things we did this past January was open our new Rapid Care, which is located in New Philadelphia on Garland Drive. And we have a behavioral health counselor that is there ready to serve, ready to help anyone who is in need of services. The individual will come in, they'll go through an assessment, and then at the end of that assessment, the counselor and that individual and their family will decide what the course of action is from there, whether it's connecting them back into outpatient services, whether it's transitioning to a residential setting, an inpatient setting. They'll kind of take over and help them navigate that system. We also do have psychiatric nurse practitioners available so that if individuals need to get started on medications that day to prevent a crisis situation from happening, or needing to go to a hospital or an ER, we have that available as well.
You mentioned off the air, I think it's important to note that sometimes if you're looking to get into different facilities, you might have to wait like months and, an extended period of time, where at SpringVale, you can get in the next day.
Yes. So right now, as I said, with Rapid Care, should our schedules get booked up, that is an option that people can be seen that day. We also have the availability to see people in our offices, a licensed counselor. We also have our psychiatric nurse practitioners available. Right now, we could get people within a day, 2 days to see someone.
That's very important, especially if you're in a situation where you need to get attention like right away. In terms of like insurance and payment and taking care of the financial aspect of being seen, how does SpringVale help folks in need?
Absolutely. So we take all the insurances that are predominant here in Tuscarawas County, Medicaid, Medicare, all the private insurances. Also, because of our partnership with the local Adams Board, we do have a sliding fee scale. So for anyone who doesn't have insurance, anyone that walks through our door, based on the federal poverty guidelines, we look at things like family income. We look at the number of folks in the household. And based on that, individuals may pay nothing for our services or, 20%, 40% of the fees.
Why do you think that mental health has been so important to highlight now more than ever?
Well, I think there is a greater awareness, just like what we're doing here. People are having conversations, people are talking about it, and I think that has led to that negative stigma. There's been a lot of misunderstanding regarding behavioral health and even substance use issues. I think more recently there's been a lot of attention because of things that have happened in the world. We have a lot more research that is coming out and focusing on, the brain is a real organ. Things can go wrong just like any other part of our body, and that we're starting to look at it as a real health issue, not just something that's tied to someone's character or because they're making poor choices or because they continue to go to the bar because their body is addicted to a substance, not because, hey, I just want to go get drunk and do stupid stuff.
It's so important. I think Ryan and I have talked about this multiple times. Like, you see, when you fall down and you hurt your ankle, you go to the doctor. You fall down and you hurt your elbow, or you have a stomach ache, you go to the doctor. But if we have something going on mentally, we just normally brush it under the rug, or we don't address it like we would an ailment, When
I was just at a conference, was it last week, 2 weeks ago, where the Ohio Department of Mental Health and Addiction Services was looking at data, and the length of time between the onset of symptoms and someone seeking help for a behavioral health issue is 11 years.
Wow.
So can you imagine having a sore throat or chest pain or a stomach ache for 11 years before you decided to go and seek help?
Wow.
So, again, I think that negative stigma, unfortunately, is alive and well in our communities, and either individuals don't know where to go to get help, or they feel that it's a character flaw, or that people won't understand, or that they'll be looked at differently. And that's not the case anymore. People don't need to fear seeking help or having that conversation.
And in so many of these conversations we've been having, we've heard that it takes getting in the door. It takes even being referred through a primary care physician, through a family member. And I have to imagine SpringVale's roots being so deep in our community's mental health, just in an overall scope. Your extension now into primary care physicians and those types of wellness checkups, that has to also help fulfill your goal of improving the community's mental health through SpringVale Health Centers.
Yeah, good point. So we know, again, through research and through science, that there is a reciprocal relationship between one's mental health and their physical health. And so many times, we look at our healthcare system and everything is disjointed. That you have to go here to see your primary care, but then you have to go over here to see the counselor, and then you may have to go here to see another specialist.
So true.
Trying to get everybody to talk and coordinate.
Yes.
You got to get your records here. You got to get this. You got to get that. And that's what we wanted to do, was have sort of that one-stop shop where people can come, you can get your behavioral health taken care of, you can get any physical issues taken care of, and your providers are there. They all talk, they all work together, they work with you to achieve your health goals, and it's coordinated. And what we're seeing and what research has shown is that your health outcomes go through the roof when you're delivering that integrated care.
We're here talking about mental health, but you're right about the at SpringVale, you guys are like a one-stop shop, not only for the behavioral side and the physical side, but you have a dentist on staff, you have a pharmacy there. So you really are a one-stop shop for like your overall health needs.
It is. And what's interesting is when you start talking about the individuals that come through our doors, we had one individual that came to our rapid care facility for a toothache. And during the course of the discussion with her providers, she started sharing how she's been feeling depressed and anxious, having some suicidal thoughts. So we were able to get that toothache taken care of. And then we also were able to offer the behavioral health services that same day. And doing much better now.
Oh my gosh. That's so amazing. Like what a testament to what you guys do for the community and everyone here. JJ, for those who may not know where you are and your new facility over there on Garland Drive, tell us what your hours are. How do we get in touch, where you're located, all of that good stuff.
Yeah. So if you go to our webpage, www.springvalehealth.org, it will have all of our current hours. It'll have all of our current locations. We do have 1, 2, 4, 5 locations here in Tusk now and one in Carroll County.
Wow.
So all the different hours, all the different contact information is on our website. They can also visit our Facebook page. We post a lot of updates there as well, and it has all of our contact information.
That was great. I think that it's such a great resource here in this community. And I thank you for coming in and talking about it and kind of helping folks who maybe are too afraid to go out and seek that help. And hopefully today they feel better and can head on over to SpringVale and get the help that they need. JJ, thank you so much.
Hey, thank you for having us, and thank you for having this conversation.
Of course.
JJ Boroski of SpringVale Health Centers. And of course, like you said, if you don't know where they are, throw a rock. It's probably going to land on their roof. Thank you, JJ. We move along here on the Ryan and Michele Morning Show, getting set for a Pets Place Lost and Found report. That's coming up right here on your Voice of the Valley.